The greatest impact does not necessarily come from the latest technology. Sometimes it can come from boring tools. Recently, I've been attending a number of workshops and courses, mostly to upskill, to learn about the latest technology. And we see it as generative AI, predictive AI, artificial intelligence. And it's nothing short of being overwhelmed by its amazing and incredible advances at the impact that it can bring. But in my experience, sometimes the greatest technology might not bring the greatest impact. Sometimes it can be with simple tools. A pen, paper, cardboard, spreadsheets. They sound seemingly boring compared to the innovations of artificial intelligence. But if we use them wisely and differently, maybe they can bring the greatest impact that we need. Now, when we talk about great impact, when we talk about boring tools, they are in comparison boring because they are common, easily available, and we take them for granted. But if we are able to pick up some of the pain points, decide on which ordinary tools we're going to use, and work it differently, maybe we would be able to bridge our dreams with our actions using these boring tools. So the idea is that sometimes we wait for bigger budgets, we wait for better systems, but the truth is, maybe what you need is already in your hands, but we need to look at it differently. I'd like to share some examples with you based on the experience that I've had. When I was a medical student, one of the things that we had to do was we had to memorize some very lengthy things in a textbook. We had to memorize line by line some of the things in terms of physical examinations. And we had to memorize what each sign was for each disease. And this came out in our clinical exams, and we would have to be trained for this when we go to the wards and in the hospital. So I was stuck. I really didn't know. I couldn't understand. It was so long and lengthy from the textbooks. So what I did was that I started to draw. I started to doodle. And from this, I made notes. I converted all these texts into notes. And what was a survival guide for me turned out to be something that my classmates started asking for and my juniors started asking for. And I started making notes for medical students. What started off as just survival notes for me turned out to be something that people really benefited from. It started from a boring tool, pen and paper. But the impact that it brought was that it benefited more than 10,000 students from 7 countries across the world, and it also helped people for the past 13 years for when it was first published. With a simple, boring tool, pen and paper. Let me share another example. When I worked, I became an infection control medical officer. So what this means was that when we work in the hospital, our role is to make sure that the infections inside the hospital doesn't spread to the doctors and healthcare workers, and it doesn't spread to the patients. So one of the things that we had to do was to train and make sure that these doctors know what to wear for their protective gear. It's what we call the PPE, personal protective equipments. So actually, on my very first day as an infection control medical officer, during the rounds, there was an infectious disease specialist, and she shouted, What's the PPE that you're supposed to wear? It wasn't to me, it was to another junior doctor, but I remember that moment for the rest of my life. Because subsequently, I was the one who had to teach training for the new doctors, and when we use slides to explain what people are supposed to wear, it didn't come easily or intuitively to them. At that time, I was thinking, what is it that we can do? What is it that I had that we can do to make the training better? At that time, my daughter, who was 6 years old, was very obsessed with magnetic books. It was the books whereby there were pictures of dolls and the clothes were made out of magnets and you just stick them on. So from there, the PPEs are also sort of like clothes that you can stick on. So this is what the idea came up with. It was made out of cardboard and magnet cutouts in the shape of PPEs and stuck onto the board using clinical examples. And instead of using slides and presenting it to people, healthcare workers, doctors, nurses, paramedics, they were able to have a lot of fun, just like how my daughter had fun with it. They had a lot of fun just sticking it on and learning about the different personal protective equipments that they need in the hospital. Simple tools, cardboard and magnets, but big impact. This was replicated in 11 different hospitals in the Pahang state, affecting hundreds of healthcare workers when they were learning about different types of personal protective equipment. And subsequently, we managed to reduce the number of healthcare-associated infections in the hospital. We also replicated this for an outbreak management, also the same concept, using magnets and as well as cardboards. Now the third example I'd like to share with you was during the COVID-19 era. During this time, I was assigned to work in the operations room of the quarantine center. At that time, whenever anyone was diagnosed with COVID, they would have to be sent to a quarantine center, and I was working in Pahang at that time. Whenever a new patient came, we had to make sure that the data was updated. We had to know how many patients there were in the quarantine center, how many required transportation to go back, how many required to be discharged, and we had to update these numbers daily. It was very important because working there, where they need to communicate with other quarantine centers and the hospital and the state, they needed to make sure how many hospital beds were available at that time. Because of limited resources, what they had was just whiteboards, papers, and Microsoft Excel. But people, the healthcare workers, they were working overtime and under a lot of stress. And we thought at that time, what could we do to improve this situation with what we had? And that's how we came up with an automated system, bed management system, and dashboard in Microsoft Excel. So what happens is that whenever a new patient came in, this automated bed management system would be like a shopping car park. So when there's no one in, it would be green. But when there's a car in, it would turn red. If there were any beds that were not available, we could turn it into black. And this way, we were able to see the beds which were empty and the beds which were available, which would improve the efficiency of the quarantine center. The tool, the boring tool that most people will look at, Excel. But the impact, it helped the largest bed center, the largest quarantine center in Pahang at that time, which housed 1,400 beds. It increased efficiency for the healthcare workers, and we reduced time from 5 hours to 5 minutes operational time. But the idea that I would like to bring forth to you is this: pen and paper, cardboard and magnets, spreadsheet. These might sound something boring to you, but let's take a step backwards. They might be different tools in different settings, but they have the same pattern. And I'd like to share a simple and basic formula of how it's come about and how we can bring out the hidden power of these boring tools using the acronym POW. P-O-W. POW. The P stands for pain points. There must be something that's bothering or difficult or you're struggling with. When I was struggling with understanding clinical examinations, trying to teach healthcare workers, or trying to find clarity in chaos of the COVID-19 quarantine centers, there must be a pain point to start with. O stands for ordinary tools. The ordinary, boring tools that we think that might not give any impact, but are actually the tools that we can use, something that we can make a change with. And it's usually something that's available to you right here, right now. And W stands for work it differently. Work it differently. Look at the tool that you have with a refreshing perspective. So that means turning lengthy text into notes. It means that turning a simple board game into an active learning tool. And it can also mean turning something repetitive in Microsoft Excel as an automated tool system. So, I'd like to invite you to start from today. What is going to be your POW moment? What is the pain point that you're struggling with right now? What is the ordinary tool that you might have overlooked? And what is it that you're going to work it with to make it work differently? Because at the end of the day, what we want is to use ordinary tools for extraordinary impact. We want to use POW to make it into a wow. And we hope that in order to bridge our actions with our dreams, we're going to use it with the hidden power of our boring tools. Thank you.